Colon cancer. Introduction. Food gets digested in the colon. Select true or false. Correct. After food is digested in the stomach, it passes through the small intestines and into the colon. In the colon, the remaining nutrients get absorbed and stool is formed. All tumors are cancerous. Select true or false. Correct. Only malignant tumors which invade other tissues are cancerous. Benign tumors are not cancers. Is it always possible to determine the cause of cancer in a patient? Select yes or no. Correct. It is usually impossible to specify the causes of cancer in an individual patient. However, general causes of cancer are known. Blood in the stool always means that a person has colon cancer. Select true or false. Correct. Blood in the stool does not always mean a patient has colon cancer. Ulcers, hemorrhoids, and inflammation can also cause bleeding in the colon or intestines. It is common for colon cancer patients to have surgery to remove as much of the tumor as possible. Select true or false. Correct. Most patients with colon cancer have surgery to take out as much of the tumor as is safely possible. During the surgery, some of the lymph nodes in the abdomen are also taken out and checked for cancer. If the cancer has obviously spread to other organs in the abdomen, some of that cancer may also be taken out. Thank you for using Explain.